The 2019 winner of the Miss USA pageant has died at the age of 30. Chesley Christ had recently worked as a New York correspondent for the celebrity program Extra. She was also a civil litigation attorney. Police say she fell from the 29th floor of the New York City building where she lived. Police say her death is being investigated as a suicide. Christ's family says hours before her death, she posted on Instagram, quote, "May this day bring you rest and peace." Chris's death is drawing attention to suicide prevention and mental health conversations. This weekend, the African American Family Outreach Project will hold a virtual mental health workshop for children and youth who studies have shown have been so impacted by this pandemic. We're joined by one of the presenters, Lisa Carlisle, the Director of Child and Young Adult System of Care with Alameda County Behavioral Health. Lisa, certainly thank you for your time. Let me start with Miss Christ. A lot of questions still, but how much does this reemphasize the need for conversations about suicide prevention?
Good evening. And this very tragic incident just highlights the importance of mental health and wellness in all of our communities. Mental health does not discriminate. It does not care about your race, your ethnicity, your gender, or your socioeconomic status. And individuals that seem to be doing well outwardly may still be having mental health challenges. And it's so important that we recognize those changes in behavior with our family, friends, and loved ones. And it's also so important that as we're working with our children and youth, that we normalize asking for help.
Yeah, looking ahead to your workshop this weekend, we've seen the numbers behind this pandemic and how it has impacted children's mental health. What will some of your advice be to parents about addressing that?
Well, I think the first piece of advice that I'd like to give all parents and families is just reassuring them that when your child or your family member is suffering from a mental health challenge, it is not a parental failure. It's not a character flaw. It's not something you did or you didn't do. And really focusing on reaching out to that young person, getting help for them, and then also the family that loves them is very, very important as well.
Yeah. We have talked on this channel about some of the stigmas or hesitancy of people of color, especially those in the African American community, may have about therapy or asking for help. How important is it to break down those walls at an early age like you plan to do this weekend?
Absolutely. And particularly in the African American community, there is a huge stigma around healthcare in general, and even larger stigma with mental health, because that is seen as something that is shameful and something that our community does not do. And what we hope to bring forward with this symposium this weekend is really shining a light on the importance of health and wellness of all communities, and particularly how to do outreach to the African American community.
Lisa, sort of in closing here, what would be your advice to people of all ages about prioritizing their mental health, especially in the last 2 years that we've had here?
Flat tires don't fix themselves. You have to get the same support that you would get for your physical health needs. You have to do the same for your mental health challenges. Check on people, ask how they're doing, spend time with people. And if you notice some changes in behavior or changes in routine, don't take that for granted. Make sure that you're asking the right questions and stay vigilant. And if you need help, please reach out for help with your mental health professionals or with your primary care physicians.
Certainly great advice there. Lisa Carlisle, thank you for your time and for the work that you continue to do. Again, that free virtual workshop is this Saturday from 9:30 to 2. If you or anyone you know is in need of support and someone to talk to, please call the National Suicide Prevention Hotline. That's 800-273-8255.